Hey guys, this is part 2 of gestational diet. Sorry if you missed the part 1, just go back and check part 1 from my channel. So starting with ketones, if your blood glucose is high, food intake should not be decreased. Speak to your dietitian. When your body cells do not get enough glucose from food, the body breaks down its fat and stores as a source of energy. Fat breakdown produces ketones, which are not good for the baby. You may ask to check your urine for ketones in the mornings before breakfast and possibly other times of the day to help ensure you are getting enough energy in your meal plan. If you're breaking down fat and producing ketones, your meal plan may need to be adjusted and may be needed to take insulin. An adequate intake of energy and nutrients promotes a healthy weight gain and good health for mother and the baby during pregnancy and beyond. Physical activity. Activities such as walking or swimming can help control the blood glucose, maintain muscle mass, and provide sense of well-being. If you're taking insulin, you may need an extra snack with certain activities. Speak to your dietitian. Before starting any new physical activity during your pregnancy, speak to your doctor about the level of physical activity that is appropriate for you. Glucose monitoring. Monitoring blood glucose level is a very important aspect of managing gestational diabetes. You do this by getting a small drop of blood from your fingertip and putting it on the test strips in a blood glucose meters. A diabetics nurse educator will show you how to do this. The nurse will advise you how often to check your blood in order to gain an overall picture of your blood glucose control throughout the day. Typically, blood is checked before breakfast and 1 or 2 hours after meals. You will be given a book or a form Typically, blood is checked before breakfast and 1 or 2 hours after meals. You will be given a book or form in which to record the result of your blood check. It's important to bring this book and your meter with you every time you attend the clinic so that the diabetes care team can review your blood glucose level. It's important to continue to check the values until delivery since they may change over time. Target recommended by Canadian Diabetic Association are shown below. So target for the glucose control. When you're fasting, it should be 5.3 or less. 1 after the meal, it should be 7.8 or less. 2 hours after, it should be 6.7 or less. Target for glucose control may be adjusted in relation to the baby's size and the mother's weight. The glucose monitor used an individual experience of the team that is working with you. The diabetic care team will review your blood glucose result regularly. If they remain above the recommended range after 2 weeks, insulin therapy may be started. Insulin. Insulin therapy is relatively easy and effective way to improve blood glucose control along with healthy meal plan. Usually insulin therapy is started in a clinic setting. Insulin is given by injections into fatty tissue 1 to 4 times a day. Injection is almost painless. The frequency of insulin injection depends on the pattern of mother's blood glucose result. Many women are concerned that insulin may be harmful to the baby. It's not. Insulin you inject is almost the same as insulin you produce naturally. It's simply topping up your own so you have enough to keep the glucose level in the target range. Occasionally, insulin injections may cause the glucose to go too slow in the mother's hypoglycemia. The diabetic care team will explain what to do if this happens. Example, take juice or hard candies to break the glucose up. When your blood glucose level are normal, so the baby's which helps the baby to grow at normal rate. As pregnancy progresses, the baby grows, the insulin needs increase. The diabetic care team will advise how to adjust your insulin dose for increasing needs. Fetal monitoring. There are additional tests that checks the baby's well-being and growth. You may ask to check your baby's movement once or twice a day over a period of time. Kick count chart, a non-stress test, or fetal monitor, which records the baby's heart rate changes with movements. You may be done to indicate how the baby is doing. Ultrasound may also be done too. Date the pregnancy, more accuracy in its early stages. Access fetal growth. Do a biophysical profile, an assessment of the fetal well-being. Assures the health of the placenta and its position. Verify the amniotic fluid level, fluid around the baby. It's not always necessary to have all these tests, and your diabetic care team will advise you whether they will be helpful in your case. Will gestational diabetes affect my delivery? Mother with well-controlled GDM or otherwise uncomplicated healthy pregnancy will likely deliver at term 37 to 40 weeks. Labor is not routinely induced, although some situations the obstetrician may suggest an earlier delivery if it's best interest of the mother or the baby. Blood glucose level needs to be closely monitored during labor. During active labor, and intravenous infusions of glucose is often given to meet energy needs and avoid low blood glucose in mothers and the baby. Insulin may be required during labor and delivery if dose used in pregnancy was high. The doctor will determine if insulin is necessary. The possibilities of cesarean section with gestational diabetes is likely higher than normal because of the increased risk of having a larger baby. Will gestational diabetes continue after delivery? Gestational diabetes disappears after the birth of the baby. Once the placenta is delivered, most women have normal glucose level without insulin within 1 or 2 days of delivery. Ideally, the dietitian will review and adjustments to your meal plan for breastfeeding and healthy weight loss if needed. In a small number of women, the diabetic will remain after pregnancy. It's quite possible these women had type 2 diabetes before pregnancy but were unaware of the problem. Occasionally, women develop type 1 diabetes during a pregnancy. All women who had gestational diabetes should be checked for diabetes after the hormone changes related to pregnancy have disappeared. This is done between 6 weeks to 6 months after the baby is born. The diabetic care team will advise you where to go for this postpartum test. Will my baby have diabetes? The baby will not have diabetes after it's born. The baby may have an increased risk within its lifetime of developing diabetes. Good eating habit and active lifestyle help reduce this risk and should be strongly encouraged. Breastfeeding. Breastfeeding is also strongly encouraged as it provides best nutrition for the baby. Future pregnancy. If you had gestational diabetes in one of the pregnancy, you have an increased risk that it will develop in a future pregnancy. If you're planning a pregnancy, there are a few things to consider. Healthy eating before getting pregnancy will ensure good nutrient stores and help achieve healthy weight. An active lifestyle is important. A healthy weight or healthy weight loss, if overweight before getting pregnancy, also help reduce risk in pregnancy, such as reoccurrence of gestational diabetes. Women who do not have diabetes before becoming pregnancy should take 0.4 to 1 milligram of folic acid starting 3 months prior to consumption or throughout the pregnancy and breastfeeding period. If your blood glucose does not return to normal level after delivery, you must work with your doctor to ensure that it's normal before getting pregnant again. It's essential that glucose control is excellent prior to and in early stage of any future pregnancy. High glucose level early in pregnancy increase the risk of baby with congenital abnormalities. Once pregnant, return to your healthy meal plan to help to optimize your weight gain and lower risk of getting GDM again. It's important that you tell your physician, look after any future pregnancy that you had gestational diabetes, so the test for gestational diabetes can be done early if needed. Long-term advice. Any woman who had gestational diabetes has an elevated risk for future and pre-diabetes, impaired glucose tolerance or impaired fasting glucose, or type 2 diabetes. These risks will be greater if there is more risk factor present, such as strong family history, obesity, or ethnicity. You can reduce the risk of being physically active, healthy eating diet, and achieving healthy weight. Ask your doctor how often you should have the blood glucose checked to see if you have developed pre-diabetes or diabetes. Hopefully, your experience with gestational diabetes will be present and an opportunity to learn about healthy living, which continues once the precious baby is in your arms. Okay, so we are done with the information session. Tomorrow I'll be doing another video on the food intakes with gestational diabetes and how much to take based on my observation. If you like this video, please do not forget to subscribe, like, and comment. If you have any other suggestions that you want to share with me and your own personal stories that you want to share with me, please do so. Thanks again for watching. I'll talk to you guys next time. Take care. Bye.